Ma'am, you are a medical person, right? Please check out him. Please help me.
Let me check. His mouth is deviated to one side. Okay? Can you lift your arm? He can't lift his arm. Can you lift your leg, please? He can't lift his leg also. This is a medical emergency. We have to call ambulance. Okay? One more problem.
Okay, ma'am. Call the ambulance.
Tell me what happened. Suddenly fall down. Are you able to talk? Are you able to pull your tongue out? I'm asking you to lift. Give me your hand. Try to lift up by yourself. Is it possible for you? Can you pull your tongue outside? Is it possible for you to lift your hand? Is it possible for you to lift your leg? Okay. Can you breathe? Yes, I would like to talk about the problem that caused here was a simple mild stroke. Okay. In cases like these, the patient will tend to have weakness or numbness in their particular area that has been affected, which in his case was on his left side. And he had his vision was not clear. He had an impaired vision. To ask him to pull out his tongue, he was not able to do that. He had speech difficulty. When I was able to ask him, he was not able to reply, though he was in his unconsciousness. His arms were not performing well. It had got to a cerebral synergy, and also the patient was not able to attempt to even come and sit on his own place. So in such cases, the patient tend to lose sensation, and they end up having paralysis on one side of their body. And in such conditions, you call them as mild stroke. Okay, it can be again differentiated, but since we are talking about him, it has just been a mild stroke. To talk about the further things, we need to do certain examinations later on. Yeah, that's it. Okay, then what's next, ma'am? To talk about this further rehabilitation, it completely belongs on to areas like physiotherapy, occupational therapy, speech therapy, and dietitians, to which when they form together a group and they work towards the patient will be having its own result based on its severity. That's it. Okay, thank you, ma'am.
Hi, I'm a physiotherapist. We are going to rehabilitate a patient with stroke. Rehabilitation means bringing a patient to normal or near to normal state. Rehabilitation includes teaching the patient and the bystander about the positioning and shifting methods. We will teach the patient functional re-educations like lying to sitting, transferring from bed to wheelchair, then rolling, sitting to standing, then gait training with walker, etc. We will assist the patient to do the movements initially and make the patient fully independent.
Hi, I am a speech language pathologist. Speech language pathology or speech therapy is one of the inevitable department which plays very important role in the rehabilitation of individual with post-stroke. Post-stroke, they may have difficulty with speech understanding, speech production, memory, use of language, reading skills, writing skills, and some may have difficulty with swallowing. Speech therapy is essential to reduce these difficulties and improve their quality of life.
Hi, I am a occupational therapist. I am here going to talk about my rehabilitation on stroke. So basically, the occupational therapist is based on the occupation. What we are giving to the patient after the stroke was that we are mainly focused on the occupation of a patient, like the ADL. We are starting from the ADL. After those stroke, the patient suffering from lot of ADL problems, like they have problem in brushing, their bathing, their eating, all these kind of things they unable to perform after the stroke. So we are just helping out them to their basic area so that they can perform their work in their daily life.
So doctors look for certain sort of symptoms in cases of mild stroke. To put it in a short form, it is called FAST. That is, F stands for face, A stands for arm, S stands for speech, and T stands for time. So talk about face, you can go for the facial deviation which you will see in terms of patient who have been attained with stroke. Talk about their arms, they will be in a certain position where they cannot move. It usually happens on only one side, okay? And talk about the speech, they will be having difficulty in speaking, so they will be, they won't be, when you ask certain questions to them, they will be having the consciousness or tendency to talk about it, but they won't be able to because of their muscles have gone to a paralysis stage. To talk about time, which is very, very important. The moment you see these symptoms, the above symptoms, that is F, A and S, in a particular place or a particular situation, don't wait for the patient to go ahead and respond in any other way. Just bring them directly to the nearby hospital wherever seen. Okay.